Hello, everyone. Thank you for choosing to join us in this breakout. We're excited to have this discussion today. As many of you know, and as many of you work with your MMRC programs across your jurisdictions, community partnerships are really essential to help implement the recommendations that your committee is coming up with. So today, we're excited to have two MMRC jurisdictions talk about community grant programs that they have developed in partnership with community organizations to help implement recommendations that their MMRCs are implementing. I'd like to start by introducing Beth, who's a part of the program in Tennessee. She'll be our first presenter, and she'll pass it on to the other presenters from Ohio. And then we'll come back together and have a robust discussion and time for questions from all of our attendees. So thank you so much. And first up is Beth from Tennessee.
All right. Thank you so much, Tegan. I really appreciate you all inviting me here today, and I'm really excited to share some of the lessons learned and some of our processes here in Tennessee about our community collaboration and how we implemented our process and some of our grant collaboration with our community organizations. So without further ado, let's go ahead and get this slide going. So just for a little bit of fun and interaction, if those of you who are familiar with Mentimeter, I do have a Menti poll. So go ahead and type in menti.com, or you can just take a QR photo here with your camera. You don't have to actually have to take a photo, but just hold up your camera there. The code is 34890504, and that will be going on in the background. If you see the mama here with her carriage, it means that there is a new question. So to kick us off, I have my first question here, and let me go ahead and start I have a timer going so I don't go over my 15 minutes, because those of you who have been in sessions with me know I can talk a lot. So we already have some answers here, and I'll show you guys who got the right answer as we start going. And we won't spend too long on this. We'll show answers for about 20 seconds. For those of you who you don't have to engage or answer the questions, but if you're like me and like being competitive and getting right answers on things, we will get the right answers afterwards. So those of you that are selecting the 50s, you are correct. So women did start giving birth in the 50s in the hospital. That's when we made the change there. So I always think about Call the Midwife with the bicycles whenever I think about that change. So our process, Tennessee started, let's see, we're on our second year of engaging the communities to start aligning engagement and the application for grants. Let's see, 2 years ago. So yeah, we're in our second year, as I said earlier, and we specifically align our request for application with our MMRC recommendations. So that is our overall goal, is whenever we sent out our RFA or request for application, we say align with our MMRC recommendations. And so these do change every single year. We try and limit our MMRC recommendations, but it always ends up being about a page and a half of recommendations, but they are able to choose whichever one their organization can carry out or what speaks to them the most. And so anybody, and we'll get to this on the next slide, but anybody can apply. So, and we do break out our recommendations into those statewide organization recommendations, hospital and provider, and actually women and their families. We do a lot up to $100,000 within our Erase MM funds, and each individual organization can apply up to $20,000. So they don't have to apply up to that $20,000, but we haven't ever had someone say we only want $10,000, or specifically 2 different organizations say only $10,000, to where we could fund more than 5 applicants. We've actually had less than 5 more of the times, depending on the quality or how those applications come in and the scoring of all of those grants. So as I said earlier, anybody can apply as long as we do have a stipulation where they have to be a vendor within the Tennessee Department of Health. So I have all my fun images here, but as I said, community, statewide agencies, facilities, hospitals, and as long as they have that LLC, healthcare providers as well. And one of our biggest lessons learned from that first year to year 2 was the accessibility and the clarity within that application. And so we did come up with a template, and that has really streamlined this process of outreaching to those community organizations and hospitals to say, this is exactly what we're looking for and how that application should look like whenever you're wanting to implement the recommendations. And so I had these linked, but I figured it would be a lot easier if we just put those in slides. So these will have links where I can share these out later on, but let's go ahead and go through the slides. So as you can see here, we literally lay it out for them. Thank you, March of Dimes, as we borrowed this idea from you. As you can see down there at the bottom, this is the March of Dimes grant template where they lay it out. Now we do also have a narrative template for them as well, but this is a really great place where it is laid out from the goal number 1, activities following, and then they can have another goal down below, when it starts, when it ends, and who exactly is responsible for that. Because oftentimes in that smaller organizations, they have kind of those, big top, executive branch, but it's really those smaller leaders down at the grassroots level that are really kind of, acting out those activities. And so that's where we'll find out who we're actually going to be working with. Performance indicators, because, as you all, those who are seeing, and evaluating these grants, they'll talk about a lot in their narrative, but we can specifically see here what exactly they're going to be looking at and tracking within these performance indicators. And as you can see up top, we have another question. So go ahead and start thinking on that question as we move on to the next slide. So if you're on your Mentimeter, you saw where the question has changed. So go ahead and answer that, and we'll get the results on the next slide. So our project narrative, and this is a big one. We gave a 3-page limit because currently we alert close to 500 people whenever we do our RFA alert each year. So can you imagine, several applications coming in, and if we didn't put a cap of 3 pages, how much reading there would be. And giving this layout for those, smaller organizations who haven't done a grant proposal like this, it really gives them that nice layout of what we're looking for, making sure that those goals are in there and their target population as well, because a lot of our recommendations, and those of you that are really active on your MMRCs, are very broad ranged recommendations. And so we make sure that that target population is in there with the activities. And then lastly, that sustainability, because this is a really short grant period. We start in January and we end in September. So making sure that we incorporate that sustainability for after the grant cycle ends. And of course, they're able to apply again, but just making sure that they have a plan in there for that sustainability. And so, and I love this one because it always trips everyone up, is when was the first urine pregnancy test recorded? And it is, actually, you guys did better than the last time I asked this question. So it's actually Egypt, 1350, and it's when was the first pregnancy test indicated and actually recorded throughout history. And they utilized a seed where the woman would urinate on it and it would become more fruitful after the hormones from pregnancy were put onto the seed throughout from the woman's urine. So that's where it was first kind of indicated, where they were testing a woman's urine for pregnancy. So that's a really fun one. I really enjoy learning about that. And I'll go ahead and change it to the next one because I believe we have one coming in towards the end. So I'll go ahead and let you guys answer that. We do let them know the unallowable costs, just because we found in that first RFA process, there was a lot of weight in some of the unallowable costs that we put in there, because with $20,000, a lot of them before COVID, surrounded with activities where they brought in members from their community to outreach and educate. And so there was a lot of incentivization and a lot of things where we told them, no, you can't have that. It just kind of crumbled that entire project that they were wanting to work on. So we make sure that we alert them that there are unallowable costs. And lastly, I'm going to discuss what was funded throughout year 1 and then year 2. So we did only award one organization in our first year due to those, difficulties with the applicants that first year. So we did award a FQHC, and it was the year of COVID. So it kind of lucked out that we had one because we could really support them and work through those challenges with COVID. So they did host eventually 4 virtual trainings because it was going to be in person with technical assistance afterwards. So it ended up being 8 virtual events where they really targeted best practices in pregnancy, cardiovascular disease, implicit bias, and domestic violence trainings, specifically with the lethality assessment. And the lethality assessment is a really wonderful tool. If you guys see Dana Moran floating around anywhere, or if you want to look her up on the networking page, she is really an expert and really hones that hard within our committee with the utilization of the lethality assessment. And so they worked really hard all summer long, putting these together and making sure that they were all available for their FQHCs. And actually with COVID and making these virtual, we were able to open this up to the entire state. So that was some really wonderful trainings that happened with this year 1. And year 2, we got to fund 4 organizations here, and I color-coded them because Tennessee is really long, so we, of course, categorized everything with West, Middle, and East. And we had 4 hospitals that were funded. So Vanderbilt University is probably the one that everyone's most familiar with, if you're familiar with Southern East Coast. And they have actually worked with 4 pilot hospitals outside of their Vanderbilt umbrella, and they're doing a train the trainer model for implicit bias trainings. So they're really putting that responsibility inside the hospital and ensuring that the bias trainings continue within that hospital and having an expert specifically trained within that hospital. St. Thomas is one of our Nashville-based hospitals. Of course, they have several other hospitals throughout the state, but specifically the Nashville-based hospital is working on cardiovascular and coronary disease starting with a focus group and branching out with PSA campaigns and educating providers on cardiovascular disease in pregnancy. And then our East Tennessee hospital, they also go by Erlanger, but out there in Chattanooga, is working with not only educating all staff, but with implicit bias, preeclampsia, cardiovascular and coronary disease, mental health and substance use disorder. You can see where they tackle a lot of our recommendations. And then they're integrating that into their EMR. And so those of you who have worked with electronic medical records, you know that that is a big task to handle. And then lastly, East Tennessee State University. So up at the top, very right-hand corner, I should have put a map on this slide. They are a really exciting group because they're actually a pediatric group. And at first when we were reading this, we're like, wait, this is pediatrics. And so we were reading this and we're like, what? And so they're really taking ownership and saying, hey, we play a big role within maternal health. And they're actually partnering with their OB team and saying, hey, we're doing this with maternal mortality. OB, do you want to help? Which is really funny. And so they're really tackling a lot of some of the recommendations that we haven't seen implemented yet, to include gun safety, which is a really touchy subject here in the South. So we're really excited to see that they're really owning that and taking that education to really educate families on gun safety, and as well as domestic violence reduction, substance use disorder, and stigma. And they're also developing a planner for the mother to use throughout that postpartum period with her pediatric visits with her child. So we are here, and I see where I've received some feedback there in the comments. So our last question here is, what continent are most twins in the world born in? And my abstractor actually referred me to this one because she has twins. And our correct answer is Africa. So just some fun facts there. I hope you all enjoyed this. I am now going to pass it on to Allie, who will be our next presenter to tell you about all her wonderful work in Ohio. Oh, Allie, I think you're on mute.
You're right. Thank you. Rookie mistake. Okay, there we go. So I am Allie, and I am a program consultant at the Ohio Department of Health with our Pregnancy-Associated Mortality Review. And today I'm going to start off by giving an overview of our community grant program, which is named the Disparities in Maternal Health Grant Program. And then I'm going to pass it off to one of our grantees, Christina from Celebrate One. So when we were considering how we wanted to spend our CDC Erase grant funds to support communities, we identified these three main goals that are on the screen now. But ultimately, it came down to getting funding into the hands of the communities so that they can do what they need to do. A lot of times at ODH, a lot of our RFPs are very prescriptive and tell our grantees exactly what type of work we want to happen. So we wanted to try something a little bit different, similar to what Bethany just told us about, and kind of just put it into the hands of the grantees and the communities to let us know what they need in their communities. So that is really what we got. We got 4 applications for our grant program. I'll be referring to it as DM21 for short. And we were able to fund all 4 applications in our first year. So we're finishing up our first year of the grant program this year in October, and we'll start a second year in October as well. So first, I'll give an overview of each of the projects that we were able to fund and identify some similarities between them. So all 4 of our grantees are located in large metropolitan areas of the state. 1 is in Ohio, 2 in Columbus, which is our state capital, and 1 in Cleveland. And then all of our grantees are targeting Black women during the prenatal and postpartum period. Another similarity with each of our grantees is that they're located in what we call our Ohio Equity Institute counties. And those counties are it's a grant-funded collaboration between the Ohio Department of Health and local partners. And it was established in 2012 to really target and address the racial inequities in infant mortality outcomes. And it's targeted in the 9 counties in Ohio with the largest disparities in infant mortality. So we all know that infant mortality, maternal mortality, morbidity are closely related, and that's a connection that our grantees also made when proposing their projects for this program. When looking closer at the Erase data to action continuum from CDC, the DM21 grant program really helps us focus on the last section, prioritizing and disseminating findings to inform action. And further, when we look at the Erase grant performance measures, DM21 is one of the ways we are working toward performance measures 8, 9, and 10, which is data-driven actions to improve maternal health. So now that I've given a broad overview of the 4 grantees, I'll give a deeper dive into the work of each of the grantees, and then I'll pass it off to Christina to talk about her work. To start, Public Health Dayton-Montgomery County, this is one of our local health departments. Their goal is to reduce the effects of adverse outcomes related to preeclampsia and eclampsia by implementing an at-home blood pressure monitoring program. So the chart on the screen now compares the pregnancy-related mortality ratios for Montgomery County to that of Ohio as a whole. And as you can see, the ratio in Montgomery County is higher. As I mentioned earlier, Montgomery County is one of the 9 OEI counties. And we know that our MMRC data tells us that hypertension-related deaths are one of the most preventable causes in Ohio. So it made sense for Dayton and Montgomery County Public Health to want to target that. The goal of this project is to enroll between 400 to 500 high-risk patients. So they're really targeting Black women and also women in the infant mortality zip codes with the most risk factors, such as a previous history of adverse outcomes or other high-risk diagnoses. And essentially, the plan with this program is that they'll have a community health advocate stationed at one of the health clinics, one of the federally qualified health clinics in Dayton and Montgomery County, and that health advocate will enroll the patients into the program, provide them the blood pressure monitor and the education, and then follow up with them monthly or biweekly, whatever the patient needs, and make sure that they are able to understand why it's important to monitor their blood pressure and give them the help and the tools that they need to address the blood pressure if they are to find that they have high blood pressure at any point in their pregnancy. Next up is the Cleveland Clinic Foundation, and the goal of this program is to fund a nurse navigation program to connect their OB patients at the Cleveland Clinic to clinical and social services. So they have other patient navigation programs at the Cleveland Clinic already, but this is the first one that is specifically focused around maternal health. So again, similar to Dayton and Montgomery County, when thinking about why Cleveland and why the focus is in Cleveland is important, you can see that the pregnancy-related mortality ratio for Cuyahoga County, where Cleveland is higher than compared to Ohio as a whole. Cuyahoga County is also one of the 9 OEI counties. Additionally, our MMRC data, when looking at the demographic characteristics of the pregnancy-associated deaths in Cuyahoga County from 2008 to 2016, most deaths were to Black women who had Medicaid as their insurer and had a high school diploma or less. So our grantees took those data points into consideration and are really targeting the beginning enrollment period of the maternal health navigation program to the practices that are located in the neighborhoods that we know that a lot of those risk factors are more prevalent. So you can see here some of the different clinic locations. That's really where the Cleveland Clinic Nurse Navigator is targeting her initial efforts. And similar to what Bethany said about developing a process in the EMR, they're also working on incorporating that into their program just to allow more efficiencies in their system. So I'm going to skip these slides because that's basically, these slides are basically just telling the process of what the nurse navigator will do. And at a high level, she is basically just focused on connecting patients to both the clinical and social services that they need, and then routinely following up to make sure that those referrals actually happened. The next 2 grantees that I will talk about are Celebrate One and the Ohio State University. So these are 2 of our grantees that are located in Columbus, Ohio, and that's in Franklin County. And they're both conducting listening sessions in some shape or form. So Franklin County is also an OEI county, and as you can see on the screen, the pregnancy-related mortality ratio for Franklin County is greater than that in Ohio overall. Both Celebrate One and OSU are really seeking to learn more about the factors that impact maternal mortality from a patient and provider level, and are hoping to do so by speaking with the impacted individuals directly. Christina will speak more about Celebrate One's work in a few minutes, so I will start us off, or finish off by talking about Ohio State's work. So OSU is conducting a research study to characterize the medical mistrust and self-reported experiences of racial discrimination in the medical setting, to understand the expectations of care among underrepresented minority patients receiving prenatal and postpartum care, and to provide opportunities for improved provider education on providing both racially and culturally sensitive care. They're also targeting Black and underrepresented minority patients that seek care within the OSU health system. And the staff that are working on this are primarily physician-led. So we have 2 maternal fetal medicine specialists, 1 OBGYN, which I spelled incorrectly there, and 1 addiction medicine physician. They're using 4 validated measures to measure experiences of racism, and they're listed on the screen now. So this study is a combination of both quantitative and qualitative data. So they're going to be using surveys at multiple points throughout a woman's pregnancy to gauge more of that quantitative data and comparison over time, and then also engage those same women in focus groups to get more of the qualitative aspects. They will then use all of their findings to publish. They will publish their findings, and then they're also going to hold a series of town halls to share what they've learned with other providers and hope to influence future care at Ohio State. So now I will pass it off to Christina. She is our fourth grantee of the DM21 grant program.
Great, thank you, Allie. Hello, I am Christina. As Allie mentioned, Celebrate One received funding from Ohio Department of Health to support community listening sessions focused on advancing birth equity. So just a quick background on Celebrate One. We are a community-wide collective impact initiative with the mission of decreasing the city's infant mortality rate and closing the racial disparity gap. We take a place-based approach to our work. We prioritize zip codes with the highest rates of adverse birth and maternal health outcomes. And so those include the OEI zip codes that Allie mentioned. So first, why did we apply for the grant? As the slide notes, we want to examine the unequal treatment of Black, pregnant, and parenting people in the healthcare system. Our goal is to create more equitable systems that treat all women, pregnant, and parenting people with dignity and respect. Next slide, please. Thank you. Based on what is learned from these listening sessions, Celebrate One partners and stakeholders will develop a plan to address findings at the community level. Some of the key outcomes that we are looking for include valuable learning will help inform Celebrate One's strategic planning process. Partners in this project will commit to action steps, creating immediate change in our community. And learning may inspire new projects or policies affecting change in the long term. So we are planning 6 listening sessions with the goal to enroll 75 people in the study. So 10 people per session. So obviously we're going to over-enroll. The listening sessions will be held virtually because of COVID. Participants will be compensated for their time. So we're planning for the sessions to last 90 minutes, and we're compensating participants for $40 in the form of gift cards. We are recruiting Black and Brown people from Franklin County with a focus on residents from our C1 zip codes, those high priority areas I mentioned. And we're recruiting individuals with lived experience. So that includes friends and family members as well. Next slide, please. Thank you. Our key partners include Nationwide Children's Hospital and Design Impact. So NCH serves as our research lead. They have provided the team training in IRB, REDCap, and data collection. And our goal is to publish a research paper based on findings from the listening sessions and the implementation of the study. Design Impact is partnering with us to train peer researchers in facilitation, community-based research, and human-centered design. And another key partner I want to mention is the Ohio Better Birth Outcomes Collaborative. OBO is a lead partner working with Celebrate One, and its members include all the local birthing hospitals. So as I alluded to earlier, Celebrate One is undergoing a strategic planning process, and these listening sessions will help inform the development of the strategic plan and our work moving forward. This is such an incredible opportunity to address the findings because we truly have the political will. Next slide, please. So one of the things that I'm most excited about with this project is the peer researchers. So if you haven't heard of peer researchers, it's exactly as the name implies. It's individuals with lived experience who are then trained as researchers. So I was blown away. We had over 54 women apply to be peer researchers, which is just incredible. So ultimately, we trained 4 women as peer researchers and 2 students as birth equity fellows. One of the students is a community health worker. The other student is a doula. So the peer researchers, they've completed the IRB training. If anybody has gone through the IRB, the CTI human ethics training, you know that's not an easy thing to do. So that was incredible. They co-designed the discussion guide for the listening sessions, and then ultimately they will be leading the listening sessions. I'm also pleased to say that they will be helping to interpret the results from the listening sessions contributing to the community reports and the peer-reviewed article. And they are compensated as well, $25 an hour. So they have just been invaluable. They've added so much to this project. And I'll also say when we were interviewing people to be peer researchers, we were looking right for Black women that had, these experiences themselves of mistreatment, severe morbidity. And I could just tell that some of the women were getting triggered. So we think it's really important that we have self-care built into when we're facilitating the listening sessions and for our peer researchers. So the last slide, please. This is just a timeline of where we're at. So we're waiting for our IRB to be approved. And then in July, we hope to start our listening sessions. So thank you so much. I really appreciate ODH. This has been incredible, this opportunity you've given us. It looks like we're ready to transition into Q&A.
Thank you so much to all of our presenters. We just have a few minutes, so I thought I would direct a couple specific questions. There are some questions in the chat, people wanting to make more connections, and you should feel free to reach out and connect with any of the presenters today to get more direct questions answered about their projects. But one question I wanted to sort of ask on the Ohio side is especially around your project at Celebrate One, Christina. I'm wondering if you've thought through how any of the information you collect could be shared back with MMRC members, and information could be shared to help inform sort of future MMRC deliberations and on recommendations in particular at the community level.
Yeah, absolutely. That was one of the reasons why I was pushing so hard for us to go to the IRBs, so that we could have something that could be considered like valid, right? And that could be, in a peer review journal, but then shared across the larger community. So we'd be very happy to share our findings with others.
Yeah, and then specifically back to the MMRC committee in Ohio, so they could sort of utilize that information as well. That would seem important.
Yes, absolutely, definitely.
One question we had in the chat for Beth was around sort of the level of funding that was available on the projects in Tennessee. I don't know if you want to address that. And then as you're unmuting and preparing to address that, maybe you could also quickly speak to the type of applicants you got. They all still seem to be healthcare and clinical related. And I don't know if you all had any consideration for how to broaden your applicant pool to non-clinical community groups in future years.
Yeah, absolutely. So the $20,000 cap was kind of a happy balance of how much can we give with multiple applicants. So we wanted to be able to give at least 5 if possible. And so we haven't specifically received any feedback. Of course, everyone wants more funding, but we wanted to at least give several applicants the opportunity. And we're still working on trying to get, the knowledge out there to as many community organizations as possible. So if you know anyone in Tennessee, let me know.
Thanks. And maybe just to both jurisdictions, one final question. I think both of these programs are really based on MMRC recommendations, and they need to sort of address something that's come out of MMRC case review. Could either one of you speak to if there was any sort of data sharing conversations with or sessions with potential grantees, or anything that you did to make sure the stakeholders applying really understood the data and understood like what would be appropriate to fund as they were designing their applications?
Yeah, so ours is directly out of the task force. We hold a meeting prior to these where we go over the MMRC recommendations directly to our task force, and that is an open committee that everyone can join.
Great, and we are going to be cut off in 1 minute, but Ali, if you have a 15-second reply before we get cut off from this breakout.
Yes, of course. So we don't have a formal way that we have shared the data in the past, but we are in the process of trying to kind of rethink the whole process so that we can engage more people and make sure that everyone has the data that they need. So
great. Well, thank you all. Thank you again for being willing to share some of these programs that are emerging and still evolving. We really appreciate everyone attending this session and hope that you're able to connect individually with Tennessee and Ohio as needed if you have more follow-up questions we weren't able to get to. So that sort of wraps up this concurrent session. I think there is a break before we go into networking sessions. So we hope that people are sticking around to network, and just thank you again to our presenters, everyone, for joining today.